This nurse is one of the most creative and resourceful nurse leaders at Chalk Children's. In addition to managing over 160 associates in our staffing office, our patient placement center, our child life department, interpreter services department, and central transport, she has done an extraordinary job in helping our organization reduce costly contract and premium labor by creating an adequate supply of float pool staff. As an example, when this nurse began, we had 40 employees when she took over this role. This particular department now has over 80 associates. For many float pool nurses, Chalk is now their employer of choice and a place where they can grow professionally. She has also implemented a creative solution to retain valuable pediatric nurses rather than lose them to other hospitals. She created Chalk's first ever opportunity for acute care pediatric nurses to cross-train to the post-anesthesia care unit, to critical care, and to the mental health units. All of these are new work areas for the float pool nurses to work. Nurses were very excited to have variety. This retention method of offering classes to upskill and have variety in the work resulted in many nurses transferring into the float pool permanently, resulting in high employee satisfaction and retention. This nurse's most significant contribution to recruitment and retention was highlighted during the recent COVID-19 pandemic. Chalk Children's Hospital was being inundated with calls from the community. In 3 days, she set up a nurse-led COVID hotline using evidence-based workflows, which quickly became a magnet for concerned parents. To date, there have been over 10,000 calls placed to this call center. The hotline included a creative partnership with the Orange County Department of Education, in which displaced K through 12 school nurses were cross-trained to augment hotline staffing. This valuable partnership was wildly successful. In recent months, the hotline nurses have also partnered with Chapman University students to provide valuable guidance and telehealth support when they are away from their family's home. This nurse's accomplishments are many. It is my distinct pleasure to introduce Linda Goodrow as this year's ACNL Award winner for excellence in recruitment, retention, and outreach. Congratulations, Linda.
Hi, everyone. I'm honored and grateful to be receiving this year's ACNL Award for Nursing Leadership in Recruitment, Retention, and Outreach. This is not a recognition that I share alone. It is one that belongs to the dedicated, caring, and talented leaders and staff at Chalk that I have the great privilege to partner with and who inspire me every day. I want to thank a few of the nurse leaders here at Chalk who inspire me. Melanie Patterson, our chief nurse, and two of our executive directors, Ann Tanner and Nancy Krebs. They are all role models for me, demonstrating every day how to support and lead in the challenging times we face, and empowering their nurse leaders to be creative problem solvers so we can respond to the new challenges as they arise. Recruitment and retention of nurses is a challenge for us all. Our goal was to grow our float pool, our nurse float pool, with talented and qualified RNs. I worked closely with our recruiters to hire RNs who have a passion for pediatrics and for float pool. In collaboration with our ICU managers and nurse educators, we created opportunities for RNs to receive additional training to care for stable ICU patients. We also found that creating opportunities for float pool nurses to cross-train in other areas such as PACU and our mental health unit significantly improved nurse satisfaction and retention. In 2 years, we have doubled the size of our nurse float pool. We have all been faced with the COVID-19 pandemic and the many changes it has brought to our lives. Knowing that accurate information was key to managing this crisis, CHOC responded quickly to establish a COVID-19 hotline to handle the volume of questions from our concerned patients, schools, parents, and community. The nurses staffing our COVID hotline are float pool nurses and acute care RNs. The group that started 8 months ago continued to serve our community, handling up to 7,000 calls per month at our peak. I'm so proud to have played a role in developing this program and the team. I'm grateful for the culture of excellence, service, caring, and collaboration that exists at CHOC that inspires me and humbles me. Above all, we are all here for the same purpose, our vulnerable pediatric patients and their families. Thank you for this recognition.